Excited to be here with you today and to discuss the agenda that we have here on the screen. So broadly, we're going to be talking a little bit about the ACA compliance landscape, challenges that are inherent to practitioners' efforts to ensure that their organizations are meeting the compliance requirements of the ACA. We'll share some insights from different benefits leaders, and then we'll talk about if you are thinking of how to design a better approach to the ACA compliance process, or some jokingly refer to it as the ACA end of year nightmare. We want to make some proposals from a process and technology perspective, some food for thought on how that ACA process can be made much better. And then if there's time and there are questions, we will take questions from the audience. So let's get going. Okay, we're going to talk a little bit about just the challenge of ACA compliance. Broadly at Trusaic, when we think about the business landscape in the United States, those applicable large employers with more than 50 full-time or full-time equivalent employees that need to comply with the IRS ACA large employer mandate, we think of two broad segments of organizations. And so segment one, this is organizations that have a portion, or whether that's significant or not, a portion of their workforce that with variable hour, part-time, and or seasonal employees. And because of the nature of their workforce, this segment has a requirement to apply the IRS look-back measurement method each month to determine which employees have exceeded an hours of service threshold of 30 hours per week or 130 hours per month. And typically these employers in segment one, because of the composition of their workforce, require assistance with both monthly ACA tracking and the annual end of year reporting process. And that contrasts against segment two, which is predominantly consists of a workforce of full-time employees, where perhaps everyone is offered coverage. Maybe the benefits are quite rich. There's no need to apply the look-back measurement method. And so really the segment two, their primary focus is on the annual end of year reporting. And so, for those of you that are on this call or maybe listening to the recording later, think about which segment you fall into, and we'll be talking through both segments and some of the kind of operational implications for both sides here. So first, we'll do a little bit of a case study diagnosis of a segment one employer. So again, segment one, this particular organization is a home health organization with a little over 8,600 employees, a lot of variable hour people, a lot of part-time people, a lot of seasonal people, multiple locations, multiple EINs, people flowing back and forth across those locations and those EINs, people working multiple positions, coming and going quite regularly. And so that's kind of the case employer that we're looking at. What you have at the bottom of the screen here is just kind of the data and process flow of the ongoing ACA compliance operations for an organization. And so you have data flowing in, payroll, HR, health benefits, and time and attendance data that flows in from the left. And that data needs to be unified and transformed. It needs to be brought together intelligently in a way that whether the data is housed in different systems entirely or whether it's housed in different modules within one point system, that data, there needs to be process and or technology that's unifying and transforming this data, cleansing it, identifying any issues with the data, and then calculating the full-time employees and making offers of coverage on a monthly basis. That's kind of the 30,000-foot view of the monthly process. And then that flows into the end of the year process, where the 1095C codes and the 1094C and 1095C schedules are created. And then those then get ideally validated and then filed with the states, filed with IRS, only filed with states in California, New Jersey, Rhode Island, and DC. And for California, New Jersey, and Rhode Island, that's for self-funded employers, and for Washington, D.C., that's for any employers with a presence in D.C., and then distributing the 1095C schedules to employees. And so what we have at the very bottom is common ACA friction points each step along the way, and I'll call out some of those, and we'll focus in particular on some of the issues that were the ones that are highlighted in blue. Those were particularly relevant or creating particular issues and friction for this particular employer. So on that initial step where the data needs to be unified and transformed, there's a lot of problems with just data completeness. That's one of the key elements of data quality that we think through at Trusaic. And so you might have missing employment classification statuses, and that's particularly important if you were a employer that needs to perform the look-back measurement method at hire, ideally at hire or at an employee transition. Employees should be being classified into whether there's a reasonable expectation that they're going to be meeting 30 hours of service or not. And if they're not, then they need to be classified into part-time designated, variable hour designated, or seasonal, and then measured over the course of an initial measurement period and then a standard measurement period. It's pretty hard to do that if that employment classification isn't present. And that's a pretty common issue that we see. It's really more of a process failure and oversight failure for employers in segment one. For this particular employer, they had a big issue with missing hire and termination dates, and that again is very common in these types of kind of high turnover industries or businesses where perhaps a segment of the workforce, maybe one particular line of business or one department or one division, has a high number of employees that are more variable hour, or they're turning over more frequently. Perhaps they're coming and going. Perhaps, again, they're working multiple positions or multiple locations, multiple EINs. And there isn't really great, robust practices for making sure that just the raw hire and termination dates are being captured accurately. That can create a big problem because any subsequent ACA logic application in any technology system is going to rely on the system's representation of when that employee was active or inactive, i.e. what the hire and termination dates were. And so that was an issue for this particular employer. They needed a process to be able to flag missing hire and termination dates. And frankly, it was going to be unrealistic for them to be able to go back retroactively and accurately capture them. So what they needed was the ability to recreate those based on hours and wages patterns in an automated fashion. From a data cleanse perspective, assuming that you do have all the data that you're supposed to, there can still and often is a lot of problems where the data, that's great that you have some data, but the data doesn't match up, right? And so often we see, and this was true for this particular employer, hire and termination dates don't actually match up with the wage and hour patterns. Or termination, you have issues like termination dates preceding hire dates because the rehire date was never entered or captured, and that could just be due to a process failure, or it could be because the system, hasn't really been configured to be able to capture that. Those two issues for this particular employer were a big deal, but overall, the ability to have automated data quality, data cleansing mechanisms in place is really a requirement to be able to deal with the scale and the velocity and just the variety of the data required to be put together for ACA compliance. And then flowing into that process of actually performing the full-time calculations once that data has been unified and cleansed. This particular employer was dealing with issues with accurately applying the rule of parity, which is that rule where if an employee has been gone for or has had a break in service of greater than 4 weeks but less than 13 weeks, and that break in service is longer than the prior period of time for which they were continuously employed, then the employer is technically allowed to be able to treat that employee as a rehire upon returning. So that they weren't able to do that correctly. The ACA employment periods were being calculated incorrectly because of missing hire and termination dates, partly, and also partly because of hire and termination dates that were being captured didn't match with wage and hour patterns. They also were not applying their measurement methodology correctly. They hadn't interpreted the measurement methodology, and they just weren't even doing initial measurement periods each month. And so, those were kind of the core friction points for this particular employer. And it had actually led to them receiving some IRS penalty letters. And we'll circle back to that here in a second. But as they were coding the 1095C schedules, beyond the issues that were flowing forward from the monthly ACA tracking, they were also not applying any line 16 affordability or other safe harbor codes. And they had no penalty exposure visibility. So they had no idea what it was that they were actually filing with the IRS. And they also had to file in California and in New Jersey as state filing. That was creating a lot of administrative burden for them. And so there was kind of two negative outcomes, if you think about it. One was the administrative burden, just the time and the effort and the energy and the attention that it was taking the organization to grapple with the complexities of the ACA in the context of their particular facts and circumstances. But beyond that, and more importantly, was that they were reporting on an inaccurate basis, and that compliance reporting that they were submitting to the IRS was actually leading to IRS penalty exposure, and they did, in fact, get some penalty letters. And so we're going to talk a little bit about a segment 2 turnaround story here shortly, but one of the main, I would say, mental hurdles that needs to be overcome is that, many organizations we see fall into the trap of, we're just going to treat the ACA as an end of year process, despite the fact that we have a high proportion of our workforce that's part-time or variable or seasonal. And so it's just really important that the monthly process be given the time and attention that's required. But the problem is, do you actually have that time, right? So it's kind of a catch-22 where employers, they don't necessarily have the resources or the time to be able to devote to the monthly process. They don't have a technology solution that helps them to drive a lot of automation to be able to simplify that dramatically. And so as a consequence, they're not doing what they need to do each month. They're not doing their monthly homework. And then when it gets time to take the test at the end of the year, they're not able to do that well because they haven't been doing the monthly homework. And then that creates all kinds of issues with IRS filing and compliance. So that would be one of the main takeaways when for Trusaic, imparting knowledge and improving the processes for this particular organization was just getting the right technology, the right processes in place to automate a lot of that work on the monthly side, and then really working with the customer from a project management perspective to show them that once you did have the technology configured appropriately, you can turn that monthly process into a very fast exercise each month. And then that turns into a much easier end of year process where you have confidence that what you're filing is accurate and that it's not going to be creating penalty exposure. And you're also dramatically reducing your work at the end of the year. So for this next case study, this is a financial services organization with 23,000 employees, very different from the last case study. This organization is predominantly full-time. Everyone's offered benefits within 30 days of starting with the organization. Because of that, this organization had no need to apply the IRS look-back measurement method each month. And instead, their big focus, their big friction points were just on the end-of-year process. And so you can see on the bottom right of the screen, it was where it's highlighted for this particular employer. They were having issues where they were listing the incorrect premiums on line 15 of the 1095C schedules, and that's because for employees, it was a great thing that they had a lot of different plans to be able to elect from and a lot of different, rich benefits plans. But what that meant was it created more complexity for the HR and the benefits team at the end of the year to be able to correctly code that premium contribution. And in this particular instance, the organization was making a mistake because they were using the premium for the plan that the employee had enrolled in and not the premium for the plan that was the lowest cost affordability plan for that particular individual. And because of that, they were incorrectly applying affordability safe harbors. And they were flying completely blind. They had no idea that was really happening because there was nowhere that was quantifying for them the potential penalty exposure as a consequence of those line 15 mistakes and the line 16 affordability safe harbor mistake that was really just happening because of the issue with the line 15 on the schedule. And so they also did receive some penalty letters. Fortunately, we were able to kind of assist them and clean up the situation that had taken place with their prior vendor, correct and explain what had actually taken place with the IRS, and put processes in place and automation and oversight to ensure that that was not happening moving forward. And in addition, one of the big complaints for the team at this financial services organization was, hey, look, it's a lot of work for us to do the filings with California, Rhode Island, New Jersey, and DC, and they actually did have to do it in all 4 of those states. Is there something that can be done to eliminate that administrative burden? And we were able to put that in place for them as well, eliminating those negative outcomes on the right side. So eliminating the admin burden and eliminating the risk of inaccurate and out of compliance reporting. Okay, we're gonna move on. We did want to share just some insights from enterprise benefits leaders that are using UKG. UKG and Trusaic partner very closely together, and we're pleased about the dual integrations that we have. We have an ACA. We have an integration for employers that are looking for assistance with that entire process of monthly tracking plus end of year filing. And we have a separate integration that's coming online next month for the employers that are looking just for assistance with that end of year filing piece. And here you just see some feedback from UKG organizations that use Trusaic, Bosley, and Scrubs and Beyond, and really just kind of speaking to the elimination of those two key friction points, the high level friction points that we addressed on those previous slides, which were number 1, administrative burden, and number 2, risk management, risk mitigation. And so, from a investment and partner strategy and HR technology support perspective, Trusaic's really proud of the partnership that we have with UKG, and are really leaning into that relationship to be able to support UKG customers that are looking for more robust support themselves around the ACA process. Okay, let's talk a little bit about ACA compliance, what we call score statistics. So one of the things that Trusaic has done over the last several years is we developed a tool that helps employers to analyze the risk that they have in IRS 1094-C and 1095-C schedules that they filed with the IRS. And so a lot of times employers that were not customers of Trusaic will come to Trusaic and say, hey, I performed this filing in 2022, 2023 with this other vendor. Is there any way that you can help me assess, what the penalty risk exposure is? Because I want to be able to get out ahead of that and make any corrections prior to actually receiving a penalty letter from the IRS. So they're just trying to be proactive. They're trying to understand what that risk is, trying to do financial planning in the worst case, or in the best case, hoping to proactively mitigate and eliminate that risk by being able to make adjusted filing corrections. And so what we're showing here on the screen is just data results around those surveys and typical penalty risk exposure figures that we find for different employee size categories. And so for those 4 buckets on the left side of the screen, you see that for employers with less than 500 employees, the typical amount of penalty risk exposure that we identify is $122,000. For employers with 500 to 1,000 employees, the dollar amount is $326,000. For employers with 1,000 to 5,000, it's 1.4 million, and for greater than 5,000, it's 3.6 million. So, and then what you have that contrasted against on the right side is the total potential theoretical maximum for the ACA penalty amounts for various employer sizes. So, as an example, for 500 employees, the total potential theoretical maximum that the IRS could penalize an organization with 500 employees is right under $1.3 million, $1.285 million. And so you contrast that against what you actually see on the left side is roughly 122,000. And you see that kind of same pattern play out, for example, at the 1,000 employee threshold, right? We see roughly 326,000. The total potential theoretical maximum is 2.57 million on the right side. And so what's the takeaway? The takeaway is that the good news is that organizations aren't creating filings and submitting filings that are creating the total potential penalty risk that they could be subject to. The bad news is that they are still creating some risk for themselves, and 99% of the time they're not aware of that risk. And so what this does is just allow you to kind of compare and contrast what's happening, boots in the ground, in the trenches, against what the IRS could theoretically, potentially penalize organizations for. And we do find that roughly 3 out of 4 of these risk assessments that we perform, those identify penalty risk exposure. And for the UKG folks that are on the call, part of the integration that we're launching with UKG in the next couple of months before the next filing season is that ability to perform those penalty risk assessments on prior year filings. And that's something that I know that the UKG team is sharing with us. A lot of the early adopter customers that they're doing beta testing with around that capability are very excited about and driving a lot of benefit from. Okay, so we're at the point of our conversation here where we're going to flip it around a little bit. We set it up where we talked about segment 1 employers from the perspective of the typical friction points and challenges that they often face, and we had a case study for that home health organization with 8,600 employees. What we're going to do now is approach it from the other side and really walk through what would the process look like end to end, monthly and end of year, if everything was kind of flowing smoothly, everything was happening the way that it needed to set you as an organization up to really eliminate those 2 big problems of administrative burden, number 1, and risk from compliance issues, number 2. And so this is the segment 1 process flow for UKG Trusaic customers that are looking for support with both monthly tracking and end of year reporting. And so on the monthly side, really the process is as simple as Trusaic captures payroll and benefits data that's being captured in the UKG environment. That data gets pulled over into Trusaic, and that gets ingested, it gets unified, it gets transformed, consolidated, and cleansed. Trusaic, over the last several years, has developed hundreds of proprietary data quality algorithms that automatically flag, detect, and fix in real time all of those kind of different data issues that we mentioned, right? So ACA employment period issues, missing hire and termination dates not matching with the actual hours of service and wages patterns, missing hourly or salaried pay basis data points, which can affect affordability calculations, all of that. I would say 99.9% of all of those issues just get automatically flagged, fixed, and resolved via ACA intelligent automation in that system. And so then what happens is that makes it such that the ACA compliance analytics and reports that are created are accurate. You can trust them, and that flows back into the front-end user interface so that the UKG user, all they need to do is jump in. They don't need to run any reports themselves. They have very simple, very clean action items. They just need to make offers of coverage to the folks that have been identified, and they know that the data quality piece has been performed correctly, that the measurements have been configured accurately, and that as a consequence, the pending offers that are being shown are accurate. So then they can follow that process each month. We also surface any missing offers of coverage that might have been missed in prior months, and that's one of the big causes of penalty risk for employers is maybe someone turned over, or maybe got busy, or maybe someone never got their paperwork back or didn't do their election in the system, right? Lots of organizations have different processes. But if the data in your system shows that someone wasn't offered health coverage, even if they actually were, if that's what the data shows, and that's what the IRS is going to receive. So we have powerful but simple and intuitive reporting that helps you to very quickly identify those situations and very quickly resolve them. And so all in all, I would say that on that monthly process, January through December, employers are taking, less than 15 to 20 minutes per month on managing ACA compliance once we've kind of put in place this process and technology and the configuration structure wrapped around that. What that means is when you get to the end of the year, you've been doing your monthly homework, you had a great structure in place, and the end of the year test or submission to the IRS, that's going to be a lot easier because of that. And so what happens then is all that data that has been being validated on an ongoing monthly basis, that is used to create the 1094C and 1095C schedules with a high level of confidence and assurance. The organization, you as the client, you receive that end of year, what we call ACA compliance report, that shows you dollar and cent, any remaining penalty risk liability exposure, so you know exactly what that is prior to filing. And obviously the goal is always to make sure that that's $0. Sometimes that, there's some little affordability issues that we see commonly with employers in this situation, where they kind of knowingly understood that when they were setting up their benefits premiums with their broker, there could be some affordability issues for some segments of their employee workforce at the margins. But the most important thing we're looking to prevent is that there is no 4980HA compliance exposure, and that's that compliance risk that arises when you fail to meet the 95% offer coverage pass-fail threshold for any month. Because that's the big hammer penalty, as it's referred to, right? Even one full-time employee obtains a premium tax credit from a state or federal exchange, and your 1094C schedule shows that you didn't meet that 95% offer coverage threshold for that month, that's when organizations can get into big trouble. And so we have a very simple but very powerful, intuitive process to make sure that that's not happening. The employer is able to review, perform a validation, finalize the schedules, and then if there's a few options for distribution, Trusaic is able to print and mail those forms. Trusaic is able to enable electronic distribution of those forms for this filing season, or just deliver a PDF so that the organization can perform the distribution themselves. At which point the e-filing happens with the IRS, the e-filing happens with states for employers that are subject to the state reporting. And then all of that is wrapped with ACA audit defense to ensure that if the IRS ever does have any questions about any of the data transformations that were done, the data analytics that were generated, the tax forms that were generated and filed, you can rest easy that that would all be handled for you. And the reason why Trusaic is able to do that is because we have high confidence in the technology and the process that we put into place for employers. Okay, so we talked a little bit about that great kind of the ideal approach for segment one employers. What we have here is a different flow. And this is for employers that are just looking for support with the end of year reporting. And typically, again, this is going to be your segment two employers where they don't really have a need to do monthly tracking. They're typically predominantly full-time employees. Most, if not all, employees are offered health coverage. And within a waiting period. And so for organizations that are just looking to remove kind of the administrative burden and any compliance penalty risk from inaccurate filings at the end of the year, that's what this process flow is. And so Trusaic and UKG have a data flow where from the UKG environment, a UKG user can configure an integration to the Trusaic ACA platform, and then pass over the XML data that was generated by UKG. They can pass over COBRA reports easily, either the COBRA data that's stored in UKG or COBRA data passed externally can be connected via API very quickly and easily, or SFTP. The Trusaic system consolidates the regular employee data and the non-employee COBRA data, generates a penalty risk assessment, passes that back into the UKG environment, and then the UKG customer, you are able to view that risk assessment within the UKG environment. And that is really powerful because what it does is it allows you to quickly identify any employees that might need adjustments in the UKG system, based on the penalty exposure triggers to make those adjustments back in the UKG source system and then repeat this process at the click of a button. And so you might do this 2 or 3 times, taking a total of just a few minutes each time. You get to the point where you've ideally eliminated all of your penalty risk exposure, and now you're ready to file with the IRS in the States. And so the Trusaic ACA platform performs that filing with the IRS, performs it with the states, and then enables the 1095-C distribution. And then to the extent that any corrections are required with the IRS, as we're all aware, oftentimes there is Social Security number and legal name mismatches with at least some of the employees. That tends to be the most common error. The Trusaic system supports all those filing corrections. So that's kind of a high-level view of what the optimal process would look like for a UKG customer that's taken advantage of the Trusaic UKG ACA Essential end-of-year reporting data filing integration. So we have a few screenshots on the slide here. We really just want to drive home the point for organizations in either segment, segment 1 or segment 2, just the importance and the criticality of having simple but powerful dashboarding that allows you to understand, what is that penalty risk exposure? But importantly, what is that penalty risk exposure that you might have for a particular reporting year, for a particular month, after you know that the appropriate data quality processes have been applied to your data, because these numbers can change dramatically once those data quality algorithms have been applied to the data. And so what this is just illustrating is I can see my A penalty risk, which is, remember that the A penalty stems from any months where you fail to meet that 95% offer of coverage threshold. Any B penalty risk, which stems from employees typically that didn't meet affordability safe harbors. And then just the kind of workforce composition metrics around how many total employees, how many full-time employees year to date, how many full-time employees year to date will actually need to be reported on to the IRS. And that number tends to be lower than the total full-time count. And then the number of employees that are triggering any type of compliance risk. And so just one thing that I always like to point out is the difference between that number 691 and 672. A lot of times we see organizations that are over-reporting to the IRS, and that creates problems from a number of reasons. Sometimes, just simply from a pricing perspective, you may be paying a vendor, and so if you're on a per form basis, so the more forms that are being filed, the higher the cost that you're paying. But even if that's not true, you just generally don't want to report on employees that don't need to be reported onto the IRS, because it creates unnecessary potential risk exposure to the organization. And at the bottom of the screen, you see the simple to-dos, right? How many pending offers? I can click and be taken to those pending offers, make those offers of coverage very quickly to employees. How many missing offers are in my system? Meaning, I should have made offers to these folks, and maybe I actually did, but for whatever reason, the data, because the only thing that matters is what the data is showing, the data that's in my payroll or benefits system or elsewhere, as that is being consolidated and brought together and unified, it's translating to a situation where the system and what will eventually be filed with the IRS shows that those people didn't get offers of coverage that they required. So by being able to quickly click on that, drill down to that, you can then make fast adjustments to ensure you're not creating penalty risk for yourself. We beyond that kind of service level dashboard, we do think that it's important for employers, particularly for those employers that require the monthly tracking, to have very deep kind of granular ACA filing metrics, almost like we think of it as like an accounting report as to what happened each month of the year from a very detailed granular perspective. And this does two things. It creates confidence within the organization that your processes are leading to successful outcomes, but more importantly, it ensures that you're extremely prepared in the event of an IRS audit. This can be rapidly exported. This can be provided to support a narrative that shows the IRS that you were doing what you were supposed to be doing throughout the year, and that can lead to rapid resolution of any IRS penalty letter assessments. So all in all, I think one of the main things that we really want to communicate to the UKG universe is if you are looking for more robust support, and are looking to potentially leverage an integrated and holistic partnership that the UKG has with external partner, Trusaic is one of those partners. We really help organizations to just drive efficiency administratively. We know and we understand that all employers are different, and so we have a very robust onboarding process that is configured and set up to be able to rapidly get you up to speed. Our team handles all the project management, all the data configuration, all the ACA measurement configuration, all the ACA benefits configuration, driving that process to make sure that your ACA kind of technology and process is set up to match the reality and the uniqueness of your organization. Just to kind of reiterate some points, that 4980H lifetime compliance perspective and understanding of what's actually going on under the hood with the data, down and dirty in the trenches, that's really critical. Data accuracy, algorithms, the reality is, yes, you could probably hire a team or do it yourself and get to a point where you built out data quality processes that could allow you to identify all of those issues that we were talking about. But it would take so much time and effort that it really is ideal to have a system that has hundreds of those checks already in place. It's happening on an automated basis, and then it's being continuously refined and learning against your actual data, so that it's getting smarter and smarter. We always talk about the importance of reduced risk reduction, of ensuring that to the extent that there is any workforce transitions, people get promoted, people leave, people go on breaks, right? And so it's critical that there be a technology and process in place that allows you as an organization to navigate that kind of change that is just inherent to being in business, and to be able to navigate that with seamless continuity. And those are the main kind of points that we wanted to really communicate to the broader UKG audience. There is other options available. Many of our customers kind of joke about how the end of year process used to be a nightmare for them, and now it's a lot more of a dream. And so that's always our goal, is how can we take perhaps what's been historically a bad nightmare and turn it into a much better situation. If not a dream, then at least something that's much more painless than it was previously. So that concludes the presentation material for today. Thank you all for those that joined.